The reasons that a male might need an artificial urinary sphincter are most commonly related to treatments for prostate cancer. Radiation therapy, radical prostatectomy, and a combination of those two therapies can lead to loss of urinary control and stress urinary incontinence. Worldwide, about 500,000 men suffer from stress urinary incontinence, and for many of them, the artificial urinary sphincter is a great option. So traditionally, the artificial urinary sphincter cuff is placed through a small incision just below the scrotum. The procedure typically takes an hour to an hour and 15 minutes, and it's an outpatient procedure. Essentially, the way the device works is that the cuff, which is similar to a small blood pressure cuff, is filled with fluid. It gently compresses the urethra to provide urinary control for the patient, and when they have the urge to void, they can go to the restroom, squeeze a small pump, relaxing the cuff and allowing them to void normally. Although the artificial sphincter has been around for a long time and it's a very safe device, there are some potential risks that we always talk to patients about. One of those is the risk of device failure or malfunction, which would require revision. There's also the risk of urethral erosion, where the small cuff that's around the urethra could cause a hole in the urethra, thus necessitating removal of the device and repair of the urethra. In addition, patients will have a little bit of mild postoperative pain and swelling, which is pretty common with the device. There are times when a unique or novel approach is required to place these artificial sphincters. In patients with a previous history of urethral stricture disease, urethral erosion, or infection, it can be very difficult to find a space around the urethra to place the cuff. In those situations, we use a novel staged approach where we first place a Penrose drain or Penrose spacer around the urethra, and then we come back at a later date. That allows a much safer and controlled situation to put in the artificial sphincter cuff and gives us a better chance at restoring the patient's urinary control. One of the advantages at Duke is that we really have the expertise and experience to offer innovative solutions to patients. Duke University is home to 2 fellowship-trained reconstructive urologists, and cancer survivorship is a huge part of our practice. Duke University and Duke University Urology have the expertise and the resources to provide cutting-edge care to all of their patients. We welcome the opportunity to take on not only the challenging cases and the tertiary referrals, but the simpler, more straightforward cases as well. We do both, and I think we do it well.